my name is Stephanie Dillon. I'm in Section 4. I'm going to demonstrate a NG insertion. What I'm going to do first is I'm going to check my doctor's orders. And the doctor's ordered a lower in a minute NG tube to be inserted to decrease the amount of excess fluid in the abdomen. So now that I have my orders, I'm going to make sure the patient doesn't have any allergies, and I'm also going to make sure that it's for the right client. So what I'm going to do now is gather all my supplies. I have my size 12 NG tube, I have the lube, I have a cold glass of water, I have a basin just in case I have any adverse reaction to having the tube put down their throat. Any gag reflexes after I put it down the throat, so I'm going to have that in handy, a towel just in case it gets messy. Going to have some gloves in the room. I'm also going to bring a rubber band and a safety pin to secure the NG tube to the patient's gown, and I'm also going to bring tape so I can anchor the tube. So with all my supplies gathered, I'm going to go into the room, knock, knock, knock. Hello, my name is Stephanie, and the doctor has ordered an NG tube to be inserted. Can you please tell me your name and date of birth, please? Okay, thank you. So I verified that it's the correct patient. So the doctor has ordered an NG tube. It's to decrease the amount of excess fluid in your abdomen. So just going to let you know that this procedure is not painful, but it can be very uncomfortable, and I'm going to let you know ahead of time that you might actually have gag reflex and might want to throw up. So with that being said, I'm going to raise the bed to a comfortable height and set the client up in a high Fowler's position. So that being said, I'm going to do some hand hygiene. I'm going to set up the client. I'm going to put a towel here. This is just so if we have any messy encounters, we'll be okay. So I'm going to put the basin right there, and I'm going to put on my gloves. Before I put on my gloves, I'm going to do hand hygiene again. So, I'm going to measure the NG tube by measuring it from the tip of the nose to the back of the ear, and then from there down to the xiphoid process, which is about here. I'm going to mark that with a piece of tape. Okay. Alright. And for right now, I am going to coil the NG tube around my around my finger for a little while, just so I can get it curved enough so that it's easier to insert into the patient's ears. Okay, and then I'm going to put that in some cold water. Please don't fall. Okay, let's pretend that's in cold water. And now I'm going to test the patency of the patient's nares. So can I get you to occlude one nare and breathe in? And then occlude the other. Okay, so it looks like the right nare is more patent, so I'm going to go with that one. Now that the NG tube has been sitting in some water, it'll make it more rigid so it's not all flimsy when it goes into the patient's nares. I'm going to lubricate it in some lube. Alright, I'm going to have the patient look back. Alright, I'm going to start inserting this in here, okay? Alright, so I start bringing it in. And as I put it down the nares, I'm going to make sure there's no coiling in the back of the throat. And at this point, I'm going to have the patient look forward, give him that cold cup of water, and I'm going to have you take a couple of sips. I'm going to have you sip the water so that I can advance the NG tube down, okay? I'm going to make it a lot easier. So I'd advance the tube. till I get to the point where I mark the tube. Alright. And he's going to continue sipping his water till I finish. And the tube won't advance any further because of technical difficulties with the mannequin. So we're going to pretend that the tape is here, and I'm going to anchor the tape on the cheek. Okay, and now I'm going to verify placement. I'm going to have the client speak to me. I'm going to hook up down the face. I'm going to drop some air, put it in here, and I'm going to listen for a swishing noise in the abdominal area. Okay. And I heard the swishing noise in the abdomen, so it's in the correct place. And I would also aspirate gastric contents, about 5 milliliters or so, and test that on the pH paper, and discard those gastric contents. That looks very uncomfortable. Okay, so reposition that. So now that I have verified those placements, I'm also going to send it down to the to radiology so that they can get an X-ray to verify 100% that the NG tube is in the correct place. Now that he's back in the room, I realized that the NG tube was flopping everywhere, and I decided to go ahead and put the secure the NG tube to the patient's gown. And I'll leave enough slack so that he can turn his head, but not so much that he can pull out the NG tube. Okay. Now that that's done, I'm going to hook up the NG tube to low intermittent suction, and now I'm going to lower the bed and leave him in the high Fowler's position so that there's a reduced risk of aspiration. I'm going to make sure my client is comfortable in as comfortable position as he can get. I'm going to make sure if he needs to use the restroom or not, that he goes to the restroom. I'm going to put his personal belongings back up here where all the stuff is, and I'm going to assess his pain level. And now I'm going to go document. As I'm documenting, I'm going to document the type of NG tube that was inserted, why it was inserted, to get rid of the excess abdominal fluid. I'm also going to document the length of the length and size of the NG tube. I'm also going to note the color and consistency of the gastric contents that I got. And I'm going to document some more stuff. The response to the response, how the patient tolerated it, the procedure, and I'm also going to document that let's say that I told the patient to sit in a high Fowler's position to reduce the risk of aspiration. Okay, and then 45 minutes or later, so I'm going to go back into the room, and I'm going to assess the patient, see how he's doing with the NG tube. I'm going to do some more heat hygiene. I'm going to put my gloves back on. What I'm going to do now is verify placement again. I'm going to disconnect the NG tube from the low intermittent suction, and I'm going to verify placement again, have those patients speak to me, and I'm also going to drop air and listen to the swishing in the abdominal area. Now what I'm going to do is I'm going to drop 30 milliliters of normal saline. I'll try to. Okay. Okay, so I'm going to, after drop 30 milliliters of normal saline, hook it up to the NG tube, and insert it into the NG tube. And then I'm going to pull back and draw it back out. And I'm going to note the amount of, I'm going to document the amount of, I'm going to discard this, but I'm going to document the amount of normal saline that I put into the patient's NG tube and the amount that I got back. So I put in 30 milliliters and I got 30 milliliters back out. So there's no problem with the NG tube. There's no residual volume. I'm going to document that as well whenever I leave the patient's room. I'm going to make sure that he's in a high polish position to reduce the risk of aspiration, and perform my 4 Ps again, because patient safety is number 1, and that should be it.